Welcome back, everyone, to AuthorStory. I am your host, Alexander Lim, and yes, I acknowledge it's been some time. This episode's featured book, which you can check out by clicking on the Amazon link in the video description below, is The How of Owl Everyday Self Care and the Art of Pain Relief. The author is Wanda Swenson, and she has been a physical therapist for over 30 years, has worked at the Kaiser Permanente Oakland Outpatient Department, as well as has become a clinical instructor at the Kaiser Permanente Santa Rosa, in addition to treating patients individually. So, Wanda, welcome to Author Story. Thank you very much for being with us.
Thank you so much for having me, Alex.
Cool. So, first off, Wanda, a little bit about yourself. What got you interested in physical therapy? What was the draw in it for you?
Well, actually, at first the draw was wanting to know about my own injuries. I studied judo for years, and I had a lot of actually knee injuries, and I wanted to learn more about anatomy and also just how the body heals. And I'd had an injury early before I started judo too, a back injury.
Right.
Went to a chiropractor and even looked into being a chiropractor, but that profession just didn't suit me as well as physical therapy is a much broader discipline. And I mean, there's so many different areas you can go into with physical therapy.
Right.
I actually thought at first I'd go into pediatrics, but I ended up more in orthopedic therapy. And I just enjoyed working with people. I wanted to be able to give something back. It just turned out just to be a really good occupation for me to pursue, and I came to the profession at an interesting time too, when it was really changing a lot, and there was a lot more information about pain science that was being applied to how you do physical therapy. Because physical therapy first came out of actually the polio epidemic, and so it was people needing a lot of hands-on work for people who were recovering from that, and little by little more was understood about neurologic kind of injuries and strokes and head injuries and all that. But with orthopedic pains, a lot was just not like, okay, you hurt a joint and the problem is in the joint, right, and that's where the treatment needs to be. And then with the more research into pain science, you realize how much is affected by pain, how much of our minds and our thoughts and emotions, affect the pain, and how the nervous system is this continuous system through the body. So, it's really movement throughout the body that is going to, affect pain.
Right. Okay.
Yeah.
So first off, I mean, the subject matter is pain, so
yes.
some people would say that pain is pain, and they'd go actively out of their way to avoid it. So, before we get on to what pain, onto the subject matter about pain, maybe define some things for us. Speaking as a clinician, what is pain and what is it all about exactly?
Well, there's a definition of pain that it's an unpleasant sensation and emotional experience associated with actual potential tissue damage. So that really says a lot. I mean, we all know it's unpleasant, and we all do want to avoid it. That's kind of a natural thing.
Right.
It lets us know something's wrong. But with chronic pain, that it works in a very different way. That chronic pain is often not about the tissue that is injured, because usually after a predictable amount of time, tissue will heal, but pain can persist, and often that's because of our fear of pain, not wanting to move in a way that might initially cause a little more pain, but it is what helps you get better. And then there's the emotional response to pain. It's often fear and anxiety. Certainly something that a lot of us are feeling these days with the coronavirus pandemic.
Right.
So any stress response we're having, and then the added, emotion, of uncertainty is actually going to add, to the pain.
Right.
So the mistake people make often with painful conditions is that they do want to just avoid pain, or they want to take a pill to make the pain go away. And both of those are roads to leading towards chronic pain. Often.
All right. Okay.
Yeah.
So before we get into chronic pain, just to debate for the basics, what purpose does pain serve? I mean, as far as the body or as far as a person is concerned. I mean, I'm thinking this thing would not happen unless there was a reason for it.
It sure is. Yeah, and it's good to respond to it and not try to ignore it. But also, it's the point of the book was to have easy access so people would know what to do, for different pains that they experience. So no, it's something that if you respond to it quickly, just from anything you might do. I mean, a sharp pain from reaching awkwardly, or just the pain that happens when you're sitting for too long or driving for too long.
Right.
To know what to do for it and not to try to ignore it. But to do something to improve it right in the moment can make all the difference in the world. One thing that did inspire me was that I have had a lot of my own injuries. So over the years of practicing PT, I learned myself, what to do. Of course, it was my field, and sort of I just would take care of things immediately,
right.
And so I would notice that when I saw a lot of patients in chronic pain conditions that had the same kind of injury that I had had, but they didn't know what to do for it.
Right.
And I'm seeing them, months or even years later, and it become a much more complicated problem, more debilitating, problem than it ever had to be. And so I started getting this idea for writing this book just after years of seeing that.
Right.
So.
Okay. All right.
Yeah.
So again, on pain, I'm sure there are, you kind of touched on this because people don't know what to do when they're in pain sometimes. But what are some of the misconceptions around pain? I mean, if we know what pain is all about, then we'd know what to do more or less. So I'm thinking, our not knowing what to do is based on some misconceptions.
Yes, that's exactly right. And I've already touched on that. For one misconception is that you can take a pain pill and
Right.
pain is going to go away.
Right.
Now, of course, we've had experiences, many of us who've had surgeries or real severe injuries, and you take one of these pills and you do feel better. But really what the pills do for you is just makes you not care about the pain as much. I don't mean to trash all pain pills, because certainly they can be a godsend when, end of life care or for, right after surgeries or a real severe injury, can really make life a lot more comfortable.
Right.
But to think that you can take a pill, long term, you take, pills like Vicodin or Norco or even, getting in real habits with, the Tylenol and Advil or all those kind of pills. What you're missing out on is that whenever there's again, we're talking mostly neuro-orthopedic kind of pains, there's always some degree of weakness that's involved with any injury, with any muscle strain or a joint injury or an injury to a nerve. There's going to be an underlying weakness because at least for a while, you're not able to use, your limb, or you're not, your spine has become strained. The deeper muscles often are the ones that aren't working well.
Right.
And it's the way we move is this whole coordination of muscles. So one misconception that is important is to realize that you need to strengthen. And when I say strengthen, I'm not talking about going to the gym and lifting weights. I mean, just simple movement is strengthening. Some isometric, kind of contractions, just tightening muscles is strengthening. But nobody else can do that for you.
Right.
So again, back to misconceptions, is that somebody outside yourself can fix your pain.
Right.
And we've often had experiences where maybe especially when we're younger, that you hurt your neck and you go to somebody, a chiropractor or physical therapist, and they do something to you and you do feel better.
Right.
And so that kind of reinforces that idea. But especially as we get older, either you're going to find that those fixes just are more temporary, or they just don't work like they used to work. And again, that is related often to, I mean, it can be a lack of movement that's happening because you're avoiding movement in a certain area, but also a weakness to the area.
Right.
So yeah, the opiate crisis was also a real inspiration for wanting to write this book. Seeing so many people, that did not need to be on that stuff, didn't know how to get off, didn't know what to do.
Right.
So I'm hoping that can help, some with this as well. And then also the aging population, a lot of us, getting older. So, movement and strengthening is very important as we age, because once you start that downward spiral, it just gets a little harder to get back. But it's not impossible, even if you're, really not very active and, feel like you're not in good shape, you've given up a lot of things you love to do.
Right.
This book it's all real simple, suggestions, movements, things you can do, and it's all geared just for doing it during the day, during your regular day. It's not like you have to, have a special exercise time. It's all things that you can do, some as you're sitting, as you're walking, as you're standing, and also things that you can do in bed before you go to sleep and before you get up.
Right. Okay.
From being in bed. Yeah.
All right. Okay. So it's interesting you mentioned the opioid epidemic, because I mean that's one of the things. That's a side topic I'd like to go on a little bit. How did this start? I mean, I get that this started as opioids started out as as painkillers, but how the heck did they get so? Would you know how it got so uncontrollable? I mean, like it is now.
Yes, I do, because I started being a practicing PT like in the 80s, and it really hadn't gotten going then. It was more in the 90s when, and actually in the 80s, what was going on was often pain, and this is like even pain for end of life kind of care,
Right.
Cancer pain.
Right.
Was being undertreated. Doctors were thinking like, well, they're going to get addicted, and people were going, I don't care if I'm addicted, I'm dying, it doesn't matter.
Right.
But sort of the impetus of that movement to treat pain and to recognize pain as something more worthy of a doctor's attention, that pain became the fifth vital sign in the 90s. And what that means is that we have really four vital signs. That's heart rate and blood pressure, temperature, and respiration rate. So those are all things that have to be within certain parameters for you to be alive and well.
Right.
Now pain got added to that, so that's the fifth vital sign. But the truth of the matter is, pain will not kill you. I mean, pain. If you go into ER with a really bad back pain, I mean, you think you're dying, but they've got other things to do. They're wanting to see people that are coming in with heart attacks or bad accidents. And so that happened, but it happened right at the same time that the opiate OxyContin came out, and that was being touted as non-addictive. And so doctors were then encouraged to give OxyContin to patients, for any kind of pain, and that it was going to help treat the pain. And then, of course, we know the end of that story, that, of course, OxyContin was addictive.
Right.
And I guess apparently they knew it at the time, but that's another story.
Right.
But anyway, so things really shifted in the 90s, and that's where, and then it sort of became more socially like okay to be on these drugs. Right. And it became very common. And then, we've just seen what's happened from there. That now, well, and I'll just add too that it's really, unfortunate because, opiates, I mean, they do really take their toll, obviously, besides, really the more severe, addiction and even, overdosing. But it actually makes your pain worse. It often affects your sleeping ability, affects your digestive functions, and you kind of just stop caring less and less about the things you love, and in doing that, that just gets your mind going more. Your life is focused around your pain, and so that takes really your whole quality of life down quite a bit, and again, does not help with the pain. And actually that is again one of the big misconceptions about pain.
Okay, okay, okay. I got that. Okay. So, Wanda, the book. I mean, this book actually, and the evolution of the way you looked at pain and treated patients as well. This came out of some personal realizations, didn't it?
Oh, quite a few. I mean, in fact, I wouldn't have written this if it wasn't for that. I
Okay.
mean, and the book is written. It's there are a lot of stories, I mean, both personal and clinical,
Hmm.
stories. But no, I was inspired. I mean, by family, by my own injuries, my loved ones.
Hmm. Hmm.
It's all of that. Yeah.
Okay, okay, good. And tell me, what made you decide to write this book? Was there any particular moment when you thought, I need to write this thing? Or was it just like, okay, over time, maybe I'll write this book, and it came about?
Yeah. Yeah. I tried to remember the exact moment because sometimes in life we do remember that
Right,
exact
right,
moment.
right.
But it was just kind of a brewing idea. It
Okay.
was just and there were so many things that, in the short time I had to spend with people that I would love to be able to tell them more about just what I know and just my perspective on things. But I did have a patient once who particularly enjoyed just how I explain,
Mm-hmm.
things. And I told her about this idea of the book.
Mm-hmm.
And she also was a writer, and she completely encouraged me to do it. And so from that point, I just sort of brought it up to more people like, hey, I have this idea about this book. And
Okay.
literally everybody I mentioned it to said, oh my gosh, I want that book. So I realized there was a market for it.
Okay,
And
okay.
you know, yeah,
All
yeah.
right.
So then I actually retired from Kaiser back in 2013, and
Okay.
I had both my parents were still around and living back east, quite elderly. So I was going back east a lot,
Mm-hmm.
and so just little by little I started working on the book, and I pick it up, put it down, and so it did take me years to get it done, and but it was a good process, and a collaborative one too. It just seems like whenever I needed somebody to help me with part of
Yeah.
part of it, the proofreading or the
Uh-huh.
illustrations and all that,
Mm-hmm.
somebody would come along. So so it's been quite the adventure.
Okay. So, this is essentially came out of your realization. So, I kind of like to do a little before and after comparison. What was Wanda like as a physical therapist before she came upon the realizations that she did come across? And what is Wanda like
Yeah.
as a physical therapist after these realizations?
Yeah, that's a great question, and I don't think anyone's asked me that before. Originally, I was very geared toward being a manual therapist,
Mm-hmm.
doing hands-on work and taking lots of courses and working with a lot of people to learn those skills,
Right.
and enjoyed it and completely enjoyed that kind of work. And then really what changed is kind of was with the medical system, we had to do more and more with less and less time.
Mm-hmm.
So the luxury, I mean, from when I first started practicing, I just had more time to spend with people. So
Mm-hmm.
you could do more manual therapy.
Right.
And then it became, that there wasn't that much time. You needed to get something across that the person could really use,
Mm-hmm.
in their lives, and maybe they didn't want to come back in for a lot of appointments, and besides that you didn't have room on your schedule to get them back in.
Right.
So it began to shift, just the quality of the work began to shift, and it became just, I mean, physical therapy is always about education,
Right.
but it just became more focused that way,
Right.
and empowering people of what they can do for themselves, and then the challenge of finding a way into each individual that might inspire them, or to get them to understand what you were trying to convey. And so just little by little, I started doing less manual therapy,
Mm-hmm.
and I
Mm-hmm.
found that I got really good results.
Mm-hmm.
That the manual therapy, while it certainly has its place, and sometimes when people are in such a state, it's just hard for them to begin to do anything on their own. But more, and and especially since I've written the book, and I'm just finding I'm actually surprised
Mm-hmm.
at the people that it's helping, that I'm not touching at all,
Mm-hmm.
and are just either looking at the pictures, reading what I've read,
Mm-hmm.
and that's actually been surprising, to me. So I have changed a lot
Mm-hmm.
in the way I approach physical therapy. Because the only way it really makes sense is to give people these skills. And again, the title of the book is Everyday Self-Care and the Art of Pain Relief. And really what art is about is developing skills. Right. So you have them yourself, and so you know what to do in the moment. Ideally, I'd love people to get enough out of this book that they don't always have to be referring to it. That there's some things that are really quite simple. And one thing I might mention that's in the book that I've really been amazed how much it's helped people as well as myself is something that I called PILL, a little take on doing a pill instead of taking a pill, but that stands for postural isometric lengthening. So this is for any kind of problem with the spine, your neck, your mid-back, your low back, and also the first place to start if you have problems with your shoulders or your hips. And it's just quite simply, you can do it in sitting, standing, while you're walking, you can do it in bed, and it's just to lengthen your spine, just to get as tall as you can. We're kind of giving it gravity all the time, so we end up, being a little slumped forward, a little bent forward.
Right.
So you do the opposite of that. You're using your muscles to, against gravity, and then pulling your belly in towards your spine, just like if you're putting on a pair of pants that are a little too tight and you're trying to zip them up, you have to kind of suck in your belly, and then keeping your shoulders down and back, because often people want to kind of shrug their shoulders up when they do this, but you put your shoulders down, and then you're just taking deep breaths, and the real trick with this. And this is something to practice, but this is something that has helped so many people, is that by, pulling your belly in and having the coordination to then breathe, with your diaphragm. So it's your ribs are expanding, but you're not, breathing with, raising your shoulders or, pulling your belly in and out a lot. So, but that is, and just holding that, for even a few seconds, even up to a minute, is just something that is so helpful for just everyday stuff. You're just out there doing something like that. You kind of tweak your back. And if you just, do that, and then maybe do that as you're walking, what it does is it just gets your muscles back in a state of coordination. Right. So you don't have to go through, days and weeks of, of neck or back pain.
Right. Okay. Yeah. Okay. Great. Okay. Cool. Yeah. So Wanda, I just want to go back a little bit on something. You did mention that pain is also an emotional experience, that emotions are, part and parcel of the experience of pain. How can emotions affect pain? Can emotions, make a pain feel worse or make a pain feel better?
Yes. And, once was believed, this is before pain science, or science, the neurologic study of pain had really gotten very far. People often believe there was just a spot in your brain that was a pain center, and there is no place like that. I mean, pain is a complicated experience, but what has been found is that something maybe a lot of people are familiar with are pain scales, because pain is subjective experience, right? Nobody else can feel your pain, right? But still, people want to get an idea of a person's perception of their pain. So they develop pain scales, which are, from on a scale of 1 to 10, 1 being no pain at all, and 10 being, the worst pain you can possibly imagine. Where would you put your pain? And, but there's another scale that actually is even better and more indicative of who's going to end up with chronic pain. And that's called the pain catastrophizing scale. So that gets into the questions are, how often do you think about your pain? So 10 would be all the time, and 1 would be not at all. And how much has it changed your life? Completely would be 10. Not at all would be the 1. And how what things are you not doing? How many things are you not doing? Because of your pain. I mean, just those kind of questions. And so yes, if people score high on that scale, that's a very good predictor for a person with chronic pain. So it is, and anyone can do this. The next time you experience a little pain, it's normal. I mean, that is part of the definition. It is normal to have an emotional reaction to pain. So you stub your toe or something. I mean, ouch, it hurts, and you're saying a few choice words. or maybe something happens that has happened to you before, and you're going, oh no, not this again, and oh, it's going to be one of those days, and you just start going this downward spiral. But if you can just take a moment to get out of that, I mean, to just acknowledge it, to recognize your thoughts, and just be present, kind of observe your thoughts, and and then just take a few deep breaths, and what that does, it initiates this relaxation kind of response, which is opposite of the fight or flight, stress response. That is what pain brings on, and then you can think of the pain as, yes, it's an unpleasant sensation, or even think about what it's like, if it's tingling or burning or whatever.
Right.
But to not, when you layer on the oh my gosh, my pain, this is awful.
Right.
I can't, I can't deal with this. That does make the pain worse. I mean, your perception of pain is worse, and it also holds you back from doing, what's, more productive, to help you get out of the pain and start your recovery really immediately.
Right. Okay. All right. Great. Because people don't usually associate emotions with pain, so yeah, that's definitely something to bring up.
Yeah, really, to start observing other people, in pain, and even in yourself. I mean, it's it doesn't take long once you get that idea in your head, like, oh, right, I'm just reacting to it now. I'm just instead of responding to it in a more positive way.
Right. Okay, cool. So, Wanda, let's say you came across someone who is in pain for whatever reason. Could be chronic, could be just temporary. And you had only time enough to tell that person one thing about the situation they're in, about the pain and the situation they're in. What would be that one thing you'd tell that person?
Let's see. I mean, that's a little tough. The thing I mentioned just a second ago, pill. I mean, depending on where their pain is, I probably I would direct them into that posture, and to just have them breathe. Just take a deep breath. I mean, really, to just take a deep breath. That was often, seeing patients in the clinic. You had to first kind of get their confidence.
Right.
But often to start, just to get them out of that headset of like, oh my God, I'm in pain.
Right.
This is terrible. Just having taken some deep breaths, like right away, will diminish that response, and then you could really talk to them. So somebody in severe pain, sometimes it's somehow getting them comfortable.
Right.
So again, this pill posture can do that. But if you're even getting yourself propped up with pillows, or whatever you might need,
right.
if you're if it's a really bad situation, but then getting them to breathe just slowly. So it's like even inhaling to 2 counts and exhaling to 3, and just to do that even 3 to 5 times, and then kind of reassess. But that really changes everything. I mean, just chemically, that has a change in our bodies, and it will affect the intensity of the pain too.
All right, cool. Okay, so Wanda, in the last minute or so of this interview, are there any last words of wisdom you'd like to share, maybe to inspire listeners?
Well, there's one that just to realize that no matter how old you are or what your situation is, you can always get stronger. There's always a degree of strengthening you can do, and also that our bodies do have this amazing innate ability to heal, if you just allow them to. And so it's never too late.
Okay.
That would be the message.
All right, great. Cool. So, okay then, in closing, the book is The How of Ow, Everyday Self-Care and the Art of Pain Relief. The author's our guest, Wanda Swenson, and you can find her book on Amazon. So, Wanda, thank you very much for being an Author Story. Thank you for sharing a lot of things about what pain is all about with us today.
Well, thank you so much for having me, Alex. You take care.
All right. I certainly will. Okay, everyone, so check out The How of Ow, along with all the other great books we've got on our channel. See you guys next time on Author Story, where we speak to another great author about their awesome book.